Hello, my name is Bolade Onilari. I'm the founder of Sickle Cell Mentorship. And I just want to tell you a story of a significant event in my life. I came to the UK at the age of 18. I found myself in a foreign land after leaving Nigeria. And about 6 months, I was in college at the time, about 6 months or so into being in the UK, I had my first major crisis. How did it happen? I was sleeping at night and all of a sudden, like my crisis normally happen, I started having this pain. It was so unbearable. At this time, my roommates didn't know I was a sickle cell patient. He just thought, what was going on here? I was in excruciating pain. I just said, call the ambulance. I had little knowledge of how the system worked in the UK. Anyways, to cut the long story short, the ambulance came, all panicked, was rushed into the ambulance, given oxygen, and I found myself at a hospital in Leicester. I think it's Leicester Royal Infirmary I found myself in. And I was admitted for, I don't know, a week, 2 weeks, I can't remember. Whilst I was at the hospital, I was getting the best medical care. All my friends from college came to see me. It was a good show of love from my friends from college. But at the same time, what really touched me was the level of medical care I was getting. But as a boy that came from Nigeria, knowing fully well what it cost for my hospital stay, I was panicking, thinking, oh my goodness, I wonder how much this is going to cost me and all that. When I got discharged, I can't remember, but I think I was asking about the bill or how much am I going to pay? And then I was told, you've got to pay nothing. I've got to pay nothing for my health. I've got to pay nothing for the oxygen I've received. I've got to pay nothing for the medication I've received. I've got to pay nothing for the drip. I've got to pay nothing for the medication I was taking home with me. I can't begin to explain the feeling of they've looked after you, and now you don't have to pay anything, but then your health is being looked after. Sickle cell disease needs money. I believe sickle cell can be tamed. I am lucky, I am blessed. Not many people live in the UK with sickle cell. A lot of people that have sickle cell live in countries that can't afford or can't even begin to fathom the idea of a free medical health. And that's where we come in. That's where you come in. That's where I come in. Sickle Cell Mentorship, we are helping people pay their medical bills. We are buying medication for them to help prevent infections in the first place and to help prevent people going to hospital. Prevention is better than cure, they say. I believe, and I'm so believe that sickle cell can be tamed. Sickle cell is being tamed. Sickle cell patients can live a happy, healthy, long lives. This is not fallacy, this is facts. However, we need to put the money in to make this happen. The cost of medication for sickle cell patients, it's not expensive. Penicillin, paracetamol, folic acid, ibuprofen, these drugs are not expensive. But I need your help. We need money. Please help. Please donate to Sickle Cell Mentorship. You'll see our website, you see the donate button. Whatever you can give is not too much, it's not too little. And I can assure you, everything you donate would be properly looked after, will be accounted for, and we'll be accountable to you and we're accountable to the UK government. Your money will be changing lives. Your money will be taking stigma out of sickle cell. Your money will be helping somebody. Your money will be promoting healthy lifestyle. If you have a business, if you're in a family and you're thinking of a charity to support Sickle Cell Mentorship, I can totally recommend Sickle Cell Mentorship. Thank you so much for listening. Thank you so much for your help. And thank you so much for your partnership. Let's take stigma out of sickle cell. Thank you.